Bismillahirrahmanirrahim. Hello everybody. So a 36-year-old Nelly Gravida comes to the office for an infertility evaluation. 8 months ago, she was found to have a submucosal fibroid and underwent an uncomplicated hysteroscopic resection. The patient had light spouting for several days after surgery but no fever or abnormal vaginal discharge. Her last menstrual period was immediately prior to the procedure, but now she has a monthly pelvic pain without bleeding. The patient has had regular unprotected intercourse for the last 6 months without conception. She has no chronic medical condition and has no other surgeries. Vital signs are normal. The uterus is small, mobile, and non-tender. Pregnancy test is negative. FSH, TSH, and prolactin level are normal. Sexually transmitted infection screening is negative. A progesterone withdrawal test does not induce vaginal bleeding. Which of the following is the most likely cause of this patient infertility? Endometriosis, intrauterine synecdoche, recurrent fibroid, tubal occlusion, uterine septum. So as we see here in this patient, that this patient suffer from developed infertility as she underwent uncomplicated hysteroscopic resection, and she has been trying to conceive for the last 6 months because she is doing unprotected intercourse with her male partner for the last 6 months without conception, but she didn't conceive. So it's mean that she is suffering from infertility. First, this patient having infertility issue. Infertility issue. Second, she having previous hysteroscopic resection for fibroid. Third, the pregnancy test is negative. Pregnancy test is negative, and she is she have mild pelvic pain without bleeding. So as we already see that she having amenorrhea. So from this patient we know that she having infertility issues, and she done uncomplicated hysteroscopic resection for the removal of fibroid, and she been doing unprotected intercourse for the last 6 months without conception, and she suffer from pelvic pain without bleeding. Her pregnancy test is negative, and progesterone withdrawal test also does not induce vaginal bleeding. So it's mean that she is suffering from Sherman syndrome. So what is Sherman syndrome? And Sherman syndrome, there is an adhesion between the uterus. So uterus, Sherman syndrome. So the uterus attached to itself. So here the correct option is choice B, intrauterine synecdoche. Synecdoche mean together. So why the choice B is the correct one? Because this patient infertility and secondary amenorrhea after her hysteroscopic myomectomy is likely due to Sherman syndrome. The development of symptomatic intrauterine synecdoche. This patient undergo intrauterine surgery are at risk for damage to the endometrial basilis layer, which create an inflamed endometrium that causes the uterus to adhere to itself, resulting in obliteration of the uterine cavity. The lack of endometrium results in development of light menses, secondary amenorrhea, infertility, and a negative progesterone withdrawal test. A hysteroscopy is performed for the diagnosis and treatment via lysis of adhesion. Come to the incorrect one, endometriosis. So endometriosis causes infertility but is not associated with amenorrhea. Choice C, recurrent fibroid. So this patient has had fibroid. A recurrent fibroid will cause regular heavy menses rather than amenorrhea, making this diagnosis unlikely. Choice D, tubal occlusion. So tubal occlusion may occur due to adhesion from pelvic inflammatory disease, endometriosis, or prior pelvic surgery. Although tubal blockage is a common cause of infertility, this patient has none of these risk factors. Choice E, uterine septum. So uterine septum is a uterine lateral fusion defect resulting in two uterine cavities. A uterine septum does not cause amenorrhea or infertility. Come again to the choice B. Why the choice B is the correct one? Because this patient having infertility issues because she has been doing unprotected intercourse for the last 6 months without conception, but she couldn't conceive. And second, she having pelvic pain without bleeding. So pregnancy test is negative, and progesterone withdrawal test does not induce vaginal bleeding. So it's mean that this patient is suffering from Asherman syndrome because she underwent an uncomplicated hysteroscopic resection for the removal of fibroid. So she developed Asherman syndrome. What is Asherman syndrome? Asherman syndrome is a adhesion in the uterus, and with the uterus adhere to itself, causes the infertility and amenorrhea.